time is actually we will be trying to find more and more opportunity that how we can grow money. And traditionally, how we grow money is actually by doing such an investment. For example, we put in our saving, we have our EPF, we have our fixed deposit, and we buy some insurance, annuity, and people who have more budget for investment, they will go for property market or public stock market or unit trust, or some people may go into business venture. Traditionally, this is how we think that we can grow our money. And some people have more luck, some people have no luck. And over the times, especially recently in the past 5 years, people start to look at alternative investment by saying that I believe a lot of you have heard about what is cryptocurrency, what is Bitcoin, even though we don't invest or we don't know the science behind that, but it become the buzzword. A lot of people have mentioned about what is Bitcoin, stable coin, all these things. Cryptocurrency investment become more and more popular. At the same time also, there are other people also start investing into gold, into precious metal, just like silver, especially nowadays, with the Iran war and Israel war and also Ukraine war, gold price have been shoot up tremendously recently. So a lot of people go into such an investment also. The other thing is actually private investment scheme. I believe that a lot of us has been approached by friends, acquaintance, business partner that say they have some private investment into certain scheme, either approved by SSM or overseas scheme. The other one is actually you may be invited to join into private company to venture into new business. So those are the alternative investment that a lot of people start getting involved into. The main reason will be why, because I think it's because of the risk and return. Because a lot of time it's actually we think that we may not have enough money because to invest in a property, you need 100 over thousand, a few million to invest into property, few hundred thousand, but the return may be like in the region of 7% per annum maximum. Okay, but of course, if the place you have the holding power, maybe after 5 years, 10 years, the value will jump 10, 20%. That's higher return. But a lot of time that we weigh ourselves through risk and return, that's the opportunity that we look at. And because of that, we are thinking that if you are ready to look at alternative investment into cryptocurrency, into all these things as a alternative investment, why not? By today, I will introduce you equity crowdfunding ECF as a new alternative investment that you should look at. Now, in a nutshell, what is ECF? Imagine this. We always have an investor who are looking for better investment. We hope that we can generate more income. And we always have a businesses that looking for funding for growth. So a lot of time that there's a mismatch over here and they don't know, investors don't know where to find a good business, businesses don't know where to find a investor. So when there is a platform that actually provides solution by matching investor and businesses together, that is actually the original idea of equity crowdfunding. That means investor offering their equity, their share, to an investor in exchange of their money. And investor invest their money in exchange of share in the hope that the business will do well. And like what Luis mentioned, some people will think of that, hey, is this legit in Malaysia? Yes, very much legit. In fact, Malaysia is one of the very, very early company back in 2014 start to come up with guidelines, laws to regulate equity crowdfunding. As you can see clearly over here, Malaysia have a regulatory framework under SC that actually govern how equity crowdfunding has to be carried out. So, in a nutshell, if you look at equity crowdfunding risk and return, you will realize that actually, if you are ready to take risk on the right-hand side, cryptocurrency, commodity, private investment scheme, and businesses, the risk is nothing less compared to ECF risk, whereby you invest into a private company. And if you're ready to look at that risk, why don't you also look at the return? Because equity crowdfunding sometimes can give a very good return. A lot of people will tell me, hey, I'm wondering that if Grab is not listed, it's not the unicorn Grab today, I can go in early. If Zeus Coffee is not Zeus Coffee today. I can go in early. If, and if. Now, equity crowdfunding give you that opportunity to come into early investment opportunity of this potential company. So in Malaysia, ACF have helped more than 300 over company to raise more than 600 million since 2024, and this is data by end of 2023. And in Malaysia, altogether, they have 12 equity crowdfunding platform, and AMB Connect is one of the platform registered with SC, licensed by SC to carry out equity crowdfunding. Now, why invest into ECF? The key point is actually security. A lot of time that you see a lot of scam news, a lot of people mismanage your fund. All these things is because that they are actually running on a platform. This is not legitimate. But ECF, when you come through AMB Connect, one thing is actually is regulated and secure transaction, and with transparency and governance. Bear in mind, everything that you invest on our platform before the campaign close is actually investment into a trustee account. We are using public Islamic trustee. That means to say that your money is not part to me or part to the company yet. It's actually part to an independent party to look after the money. If the investment is successful, scheme is successful, and all the requirement is fulfilled, then only the money will be parted and the share will be transferred. So a secure platform is a very important thing. The next thing is actually ECF allow you to diversify your portfolio. I know a lot of people say that I have a budget of 500,000, I can invest into this. But what if 500,000, you can invest into multiple companies. You can invest into 50 companies. You invest into 5 companies, 100,000 each. It will further diversify a risk, because every investment courses that you take will tell you that it's always best idea to diversify investment to maximize and mitigate your risk. The next thing is actually, this is very important because we give you exclusive perks, early access into a company. This is especially correct today because today we are going to give you a exclusive early access into a very unique company, which normally you are not able to access. This is the uniqueness of ECF. And most important thing, you'll be part of the journey of the growing and potential company. Look at the company, and if you look at the idea, like what they're doing, and you are confident of what you're doing, you can be part of the journey and grow together with them, and at the same time, earn the benefit. Next thing is actually, Malaysia also encourage all the investment into ECF, thus there's tax incentive into individual who make investment into the private sector company that using ECF. So for more details, you can always reach out to me or my colleague in AMB Connect. We are more than happy to explain further to you on this detail. Now, in ECF, a lot of time is actually when you make investment, we are talking about how many times that the return that you are looking at. This is where we are looking at a unique opportunity. AMB Connect always look at the idea that we want to look at opportunity which is exclusive, which is early, and which can bring good return to us and also our investor. Of course, having said all of this, we need to remind you that as with every investment, equity crowdfunding also have their own risk. First thing is liquidity, because you must understand that you are investing into a private company which is not publicly traded, the share. So when you want to actually sell off your share, you may have issue with the liquidity of easily dispose of your share. The next thing is actually there might be a risk of fraud. There might be a risk of failure. It means that the company will fail because no one can guarantee the success of one company. But what we can do is actually we can always mitigate and do proper duty and review it. And the next thing is actually you might also experiencing equity dilution, because if new investor coming, your share may be diluted. So bear in mind, there are still risks associated with ECF. So a quick intro about AMB Connect. AMB is actually stand for all Malaysia businesses. This is true to our idea is actually why we want to do equity crowdfunding, because we want to provide this opportunity to connect all Malaysia businesses, regardless of their territory, geography area, regardless of their stage or sector. We want to make sure that they have opportunity to access into the right resources, be it money, partners, or friends, or customer. So AMB Connect is the Islamic equity crowdfunding platform, meaning to say that we only host Sharia compliance campaign, which is 100% Sharia compliance. And we promote inclusivity, means to say that we want to make sure the community coming together to support what we have and to support Malaysian businesses. So a quick outlook about our background, our history. We actually incorporate the company back in late 2022, and we start our application in early 2023, and we got our approval in principle by October 2023. And after 1 year of fulfilling all the conditions, tough and very stringent conditions set by SC Malaysia, we finally get our go live concurrence from SC on the 4th of October 2024. And we have our formal launching on the 23rd October of 2024 by our YB, Dato' Evan Benedict, the Minister of Cusco. So we are actually deeply committed to our investor. The first thing we are committing is actually we hope to give them a variety of selection of the best company that we have viewed. We hope that we provide them a seamless investment experience, be it through online or manual. We are actually able to attend to that, and we provide you with Sharia compliance capital investment option with the peace of mind. And bear in mind, it's zero cost. Meaning to say whatever you invest, there is no management fee, there is no other fee. Whatever you invest is the amount that you invest. Okay. And the next thing is actually we are always here to support you with our supporting staff to answer all your questions, to make sure that your concern is well addressed regarding the platform. So, as I mentioned, we are Islamic crowdfunding platform, and because of that, we have our own Chief Sharia Officer. We have our Sharia Office Advisor in Masraf, which is actually Sharia Advisor member also to SC, to Bank Negara, and we also have our own Sharia committee. And to make the investment and due process more robust and prudent, we also have our panel of industry experts, meaning to say we appoint experts from different sector, different industry, and the list will grow further and further to firstly help us to do an early duty. Whenever we have a case, we'll go do a duty process, and our expert will be part of the team that tell us whether this is actually a workable idea, workable business. That's how we actually also not just depending on our own knowledge, our own internal knowledge, we also depend on the industry expert to help us to make a better decision, to ensure that the opportunity that we share will be really something that is workable. So we have something called AMB Connect Community, whereby we hope that we connect the whole community together, that we can pool resources together to help everybody to achieve their target. Investor can invest comfortably and also share their resources. So the community actually comprises of members from associations, industrial expert, institutional investor, service provider that is actually necessity to everybody. We also have issuer, which is company that fundraise with us, and also individual investor. So a key takeaway is actually, first, we provide wide selection of investment, which is carefully curated and make sure that we actually meet all the criteria from all sector, all stage, and all risk profile. And we hope that we can provide you with multiple investment mode in pref share or ordinary share. And we are the only Sharia compliance platform at the moment, which is actually locally, okay, 100%. And we are committed to ESG as usual and sustainable investment because we hope that our cases, our opportunity that we pose make an impact into Malaysia. And right to say that what we are going to show you later is actually our platform. So if you are interested, you can actually visit our website, which is www.ambconnect.com. You can actually go to our business center to see our website. And so before that, Luis, give me a minute, a quick one. This is an opportunity that we want to share with you together. And Trust me, this is a very unique opportunity, and we have actually spent no less than 6, 7 months with the founder, go through a very thorough due diligence with them, go through independent third-party due diligence with them, and we found out that this is a very unique opportunity that we believe you should look at it because it actually resonates with me personally, something that what they want to do. Imagine you can test cancer differently, non-invasive, fast, and it's a good thing because to test cancer using biopsy is not an ideal thing. So I hope that later you can pay some attention, spend with us some more time, listen to Dr. Rajan, how they have this very, very good and strong proposition that they want to put forward. And it is one of a unique opportunity as a Malaysian. We can look at it and grow them as a unicorn that represent Malaysia. Thank you for your time. Thank you.
Okay, thank you. Thank you for your sharing. I think you did points out some things that I would like to, take as notes that whenever this is an investment. So whenever you guys invested in any sort of investment, they're actually associated with the risk, where high risk, high return is always the rules. So there's nothing like invest in something high return and they can tell you like, oh, zero risk or none of the risk. It's no such thing in the world. Okay, so if you find it, you tell me. Okay, I also want to invest. So second thing is that I like what have shared is that it's actually when you invest, you are investing in supporting a local company. So a local company is actually developed by Dr. Rajan and his team. So that's something that I would say in Malaysia compared to US Silicon Valley, there's something that is a bit lack of. That's where Malaysia Securities Commission have this kind of platform to curate or incubate more startups that really can boost up the whole nation. That's one. And the last thing is that it is a legit platform in the sense that whenever you invest all sort of money, they will not hold your money. Meaning, for example, like if you are investing like 100,000 today or 200,000 today, the money is not kept by or kept by AMB or kept by Dr. Rajan. Correct me if I'm wrong. It's actually gonna hold your money at one of the third-party bank, which is a trustee bank, which is there is your money will be safe. Okay, so as long as the money, the campaign once it's successful, everything legal documents done, everything, then only the money will be transferred to the issuer, which is Dr. Rajan's company, BreathDX. Okay, so I think if let's say today you want to pull out, you don't want to invest anymore, so there's no cost for you. So I think that's something that is it's a good opportunity for you all, to understand the later one. Will be shared by Dr. Rajan, which is he has something to tell you, a story to tell you, because it is BreathDX is a Malaysia medtech startups, pioneering in non-invasive cancer detection using AI-powered breath analysis with the accuracy of more than about 94% with just a single blow, and you can get the result in 30 minutes. So I've seen through the business deck, is targeting like the global market at about US dollar close to 280 billion. Okay, so it's actually scalable. I will let Dr. Rajan to share about how scalable it is, because it's something that we can't have the whole building that you can't move in here and there. But with BreathDX, it can actually easily that you can do the test in any region of any way, any place in the country. Okay, so without further ado, let me invite Dr. Rajan to be on stage with us to share with us this opportunity that to everyone over here. Dr. Rajan? Dr. Rajan, you need to unmute.
Yeah, thank you, Louis. So I think some of you I've met before, Rennie, Leuven, right? I've met you all before. I will go through the presentation and then, at the end of it, you can ask any query you have, right? Next. Okay, I think these are disclaimers that we have to put because, we are fully compliant with our Securities Commission. Next. Okay, So we were valued, as we brought this technology from the University of Michigan, we were valued at 338 million US dollars or 1.48 billion ringgit, right? That makes us right away a Malaysian unicorn. Next. So, you know, what we are is that we have IP that has global significance, right? So we have pioneering IP, intellectual property, in gas chromatography. This is how you separate particles in the air. And, you know, it's been known in Chinese medicine, Indian medicine, you know, Malay medicine. You smell a man's breath, you will know what's wrong with him. But we have taken it to the next level with gas chromatography, with microgas chromatography. And the work was done in the early days by Linus Pauling himself, who won a 2-time Nobel Prize in his lab. Next. So this is what we bring onto a table. This is coming from University of Michigan. We've been developing this in collaboration with the founder, Dr. Sherman Fan. Next. That's Dr. Sherman. He's a tenured professor at the University of Michigan. If you Google him, you will see he's a man of many brains. He has a lead position in microgas technology. I spoke to him day before yesterday, and he was telling me that nobody is even 3 years near us at this point in time. Next. So we've done trials in University of Michigan, in University of New Mexico in the United States, in Bari, Italy, and we are about to start some work with the University of Humanitas Research in Italy. We are looking to develop data at Harvard Medical School and the United States Veterans Administration. We already have markers for lung cancer, colorectal cancer, and in the peak of COVID, we even developed markers for COVID. That was with a grant of 2.2 million from the US government. We are developing now breast cancer markers, prostate cancer markers, and ovarian cancer markers. We own all of BreathDX USA and have a stake, a license with RUA, and we are developing a CLIA license right now in the US. Next. So as I mentioned earlier, some 25 million has already been invested over a period of time, where the founders, other investors, as well as the US government put in a total of $25 million. The process is very simple. You breathe into a bag for 2 minutes, then that markers are transferred to this machine, and then that is then allows you to diagnose known breath markers on the cloud, and you get the results back in 18 minutes. So you take a test, you take a breath for 2 minutes, you go out there for 18 to 30 minutes, have a cup of coffee or tea, come back, we give you the results. Next. So now we're going from here to Harvard Medical School, Mass Gen Hospital, which is linked to Harvard. And you know, in the meantime, we are also going to look at the CLIA lab in New York, and we want to look at breast cancer via mammograms. Next. We have a Chinese FDA approval, and with that approval, we can have this product registered in Malaysia, even if we don't have a US FDA approval. Next. In Malaysia, they have many different steps to get to that. And the president of the CEO of the Malaysian Medical Device Authority, Dr. Murali, I've spoken to him. He wants us to put our files in. He's very supportive of a Malaysian registration. Next. Okay. These are things we have done to date, and all of it happening at the University of Michigan, and also in related areas. Next. Now, it's very important that we have done this very important lung cancer trial that was that was presented at an international conference involving altogether 5,000 delegates from 103 countries, where our work on lung cancer detection using the breath won the President's Choice Award, the Top Abstract Award, Thoracic in a Young Investigator Award. Since then, we've been doing trials elsewhere, including in China. Next. Next. So the market, I don't need to tell you all this, is a very growing market. At some point, half of humanity will have cancer at various stages. Next. Okay, what makes us different? So this is how the machine looks like. It's altogether 8 kilograms. So you can lift it. You can put it in the back seat of the car and drive it around. It will detect lung cancer with an accuracy of 94%, 94.9%. It's totally non-invasive. You can detect cancer in all stages from stage 1 onwards. And as you know, with cancer, the sooner you detect, the more the chance of success, the less the suffering, and the less the cost. Uniquely, we can test patient trajectory. In other words, you can see how you respond to a treatment, be they surgery or chemotherapy. After you do it, we can test your markers and tell you right away whether you are on the right therapeutic approach. As I said earlier, the whole process is 18 minutes, but with the testing, the blowing in, we say you will get your results in 30 minutes. Because if we don't have a lab, because we don't have reagents, we don't move things around, our costs are low, and we are scalable globally as soon as the authorities approve us. Next. Now, it's very important. This is probably the most important slide. All of testing has only two. One is the doctor will tell you straight away at the point of care or the point of need. And the other one is they take your blood, they take your stool, they take your whatever and send it away to a lab and then tell you come back 10 days, 1 week, 3 weeks, whatever, and you wait, right? What's growing right now worldwide is point of care or point of need. You go into a doctor, you get a test immediately, you come out. Every test ultimately will go there. Many, many years ago, when my grandmother used to go and see a doctor for her diabetes, she used to take her urine with her. And then they will take the urine and then they will ask her to come back. Today, you just take a blood glucose meter, you prick your finger, you know your test. That is what's called point of care, right? So point of care takes the whole infrastructure out. You don't need appointments. It's simple to use. Normally, you don't need a technician. You get high accuracy. You get immediate results. Therefore, you get earlier treatment and you've got less anxiety. And of course, it's going to be cheaper. Next. So if you look at the competitive field out there, and you can Google us right now on an AI like Perplexity Pro, which is the most effective AI when it comes to R&D, we are ahead of everybody. We are ahead of Owlstone, which is University of Cambridge. We are ahead of Technion, which is the MIT of Israel. We are ahead of the Swiss, ahead of the other American company, Portable GC. We are ahead of a Swiss company, a Belgian company, and we are ahead also of a French company. So how often do you see a Malaysian company lead a field? How often do you see a Malaysian company ahead of Israel, right? And to be honest and to be humble and to be fair, it's not us. It's the University of Michigan. We were just lucky to be working with them. Next. So, ultimately, you as investors want to know one thing: how do you make money? So we are going to go to a B2B approach. We're going to go to hospitals. We're going to private clinics, urgent care centers, IV infusion centers, assisted living centers, integrative healthcare centers, right? And we're going to work directly with insurance companies and related players. Next. Okay, testing, all right? So this is how we make money, obviously, when we test. But we also have another model. We can lease the machines and make money out of the machines. And finally, we are getting a very strong, rich database, and that it becomes a base for recommendation to pharma companies, to insurance companies, and for the dietary supplement makers. Next. So these are all our partners. And Rua is the one that works with us, own the rights from Michigan. This is a lab that does the testing for us now. Centroid is the capture bag. Chromax manufactures the device right now in China. Holista is my company. We are the representative for the region. And PermaPure, when you breathe out, your air you breathe out contains a lot of moisture. We got to dry that air so that it doesn't degrade. And that's their technology from Canada. Next. In the US, we are going to work with Henry Schein. Henry Schein is a very large distributor to doctors and dentists. They have 1 million doctor accounts. And they are in New York, so we'll work with them. Next. Here, it's Holista that will represent BreathDX. Next. In Asia, we're going to work with Zulik Pharma. Zulik Pharma has access to 13 different countries, all of ASEAN, from the key ASEAN nations and 3 others. In every market, Zulik is the market leader, except for Thailand, where they're number 2 to Dietlam. They are the leading medical device here. We have a long relationship with them. I actually know family members who are based right now in Philippines, in Manila. Next. So now we are going to commercial. We're going from an inspiration to impact. We want to launch next quarter in New York. We want to launch the quarter of that in Malaysia. Next. This is the projected income statement in 2025 and in 2026 and 2027. And this is the kind of profitability we are aiming to achieve. And this, if you look, is based on the number of machines, because we're assuming every machine does 2 tests per day, just 2 tests per day, right? And you can see that these numbers, once we get through the registrations, these numbers are actually very, very achievable. Next. Obviously, in any business, you want to be able to get your revenue up and increase your net profit. And because our model is very thin, we don't make investments in labs, in technicians, in advertising, right? So we are able to increase revenue while keeping the net profit where it should be. Next. So these are the countries that are doing lung cancer now. You will see that, you see North America, you see South America, you see Europe, you see Africa, you see Asia, and you see Australia. You don't see Malaysia there. Next year, this time, you will see Malaysia there as well. Next. This is Dr. Deborah, who's our medical director. She's picked up by the International Association for Lung Cancer Study, and she will be finishing the study that for us in the University of Bari in Italy. Next. In the US, you don't need FDA registration. You need a CLIA approval, and you can test your product in labs. And we've been working on it for the last 9 months. We're very close to getting that. We hope to get that in the coming quarter. Next. We already got the CLIA in February. And from here, we want to go, we have already hired, or we work with a medical doctor who's our lab director. And we want to look at testing to begin there. Next. Now, for those of you who are investors, I think this is a very powerful chart for 2 reasons. Number one, it gives you a perspective of, how the market values these kinds of technology. Number 2, the day we launch, this is a stock that you should, even if you don't invest here, you should look at shorting. So this is listed in NASDAQ. The company is called Exact Biosciences. You can Google them right now. They're actively trading. Their market cap is $10.6 billion US. And you can see the revenue growth from 2014. But, they do colorectal cancer. And the way they do it is you're going to buy a bag, a box, You're going to put your stool in it, treat it in a very special way so it won't smell, seal it, and ship it off to a lab in Wisconsin. And then you're going to wait for 4 to 6 weeks, and it costs $600. So despite all that bother and trouble, they still have revenue of almost $3 billion at the end of last year, and their market cap is 10.6 billion, and it costs 56.17 per share, right? And you just take one deep breath out, and then you go and have a cup of tea or coffee and come back in half an hour, we'll give you the results. So as I say in this slide, we've taken all the shit out of it, right? And we have a simpler test, faster test, less expensive test, and you get a quicker result. So this is now for colorectal cancer, right? One test, and they have a market cap of 10.6 billion. Next. This is now a blood test for colorectal cancer. This is a test where you take blood. You got to wait for about 10 days. This is FDA approved, and it costs almost $900 per test. And they have a market cap of $5.1 billion, and they're trading at 40.46% per share. We are far more accurate, far faster, less expensive, non-invasive, and unlike our competitors. Next. This is a company called Galleri. They do not test whether you have cancer. They will tell you that you likely can get cancer, right? And despite that, they are also listed on NASDAQ. They have a market cap of $12.81 billion, right? So these are all single product companies, right? We have one test, and soon we'll be able to do 10 different tests. Next. This is the team that's working with me. So you will see that we have the medical advisors, Dr. Deborah and Dr. Diana. Raghu heads the lab. Asher is our head of regulatory affairs. Jeremy, who's my partner, he actually passed away last week, and he was just buried yesterday morning. Dr. Sherman is the inventor of the test. Junki is a student. Junki has taken that test, owns the rights to China, and is manufacturing for China. Dr. Sarat, he is an advisor. He works very closely with the Indian government, and he wants to take this into the screening market in India. Next. Okay, so obviously any investor wants to know, I'm putting money in, how much do I make, when do I take it out, right? So we are working on an exit of 24 to 36 months. We either will sell to a medical device company, or we will go public via NASDAQ. Next. If we sell, these are the players who will buy us. Everybody's looking for new growth opportunity. And all these companies, Roche, General Electric, Agilent, formerly Hewlett Packard, Siemens, Medtronic, and Thermo Fisher Scientific, right? All of them big boys, all of them have huge budgets, all of them looking for new growth opportunities. But I prefer going public. Next. Where we've tried once via a SPAC that did not work, but we are about to sign with a company called Exchange Listing LLC. Actually, Eng and his teams don't know this yet, but the two founders of the company are coming to KL to see me on the 15th of July. And on the evening, they're holding a public meeting, and I'll invite all our investors to come there and talk to them about the opportunities that will come out of NASDAQ listing, because they are pitching for our account to get us listed on NASDAQ in the next 15 to 18 months. Next. We did various valuations. For the SPAC, we settled at 500 million. Our current valuation at 25 cents per share is 32 million. If we do a discounted cash flow, we're 37 million. All the AI-based projections show us at about 202 million, which is all quite consistent with the 338 million that we got with the value IP. All these are US dollars. Next. Now, apart from this, these are some more things that will add to the value when we do the Harvard trial. When we move to Malaysia, we have already moved to Malaysia where the taxes are lower. And FDA approval will obviously improve our value quite a lot. Malaysian government approval will improve our value a lot. Approvals in Europe, India, Japan, Korea, Taiwan will do, and manufacturing in Malaysia. As all of you know, we now make the product in China. With Trump and tariffs, it's not going to work. So Junki and I are working to move it to Kuching. And I had a very, very good meeting yesterday with literally every head of department in Kuching, from Sarawak Invest, Mintrade Sarawak, Ministry of Agriculture Sarawak, Ministry of Health Sarawak, state government, right? It's a very, very high-powered meeting yesterday, and they have in principle want us to go there, and they're offering us land to be based in the Samajaya High-Tech Park. Next. This is how the structure is. Before I met Ng, we only were this one here, which is BreathDX Inc. And now BreathDX Malaysia, where you'll be investing, owns the whole world. Any other region will come in here and you'll add on to the revenue of BreathDX Malaysia Sdn Bhd. So all revenue will be posted here. All investments will come here. All dividends will be here. This is the company going for listing on NASDAQ. Next. This is the current board we have. And there will be more changes coming, which I don't want to discuss right now, but you will see we'll be adding more board members and strengthening this board further. Next. This is the current shareholding. I am the second largest shareholder, but we will be, again, here there'll be more changes that we will announce, obviously, as to all our investors. And right now, you too would become part of this shareholding. Next. So this is how we intend to use the working capital. I mean, the money we raised, 43% will go to working capital, and the balance will go to research and development, regulatory compliance, staff costs, expense reimbursement, and operating expenses. Next. Okay, here is the three modes in which you can invest. And probably here, I would like to get, my collaborators at AMB who are much better at it to take over. Ng or Sam?
Yeah. Sam, are you available?
Yes, I'm here. Ng left, is it? Okay, can we go back to the previous slides?
Yes.
I think here, sorry. Yeah, for now, what we BreathDX has proposed or recommend here is if you invest early investors at 5,000 ringgit A and B, C packages, so to speak, and each package they will give, like you can see, there's a discount on one of the breath tests when the machine is here. Then to 20,000 ringgit investment, you have tests for you and your spouse, your partners, and then or 3 tests. There's a typo in B. And all the instrument issued will be redeemable, convertible, cumulative preference shares at a dividend of 10% per annum. What this basically means is that in the event dividend is not declared for any 1 year, it will be cumulated forward to the next year. So the following year, there will be a 20% dividend. Convertible, yes, there is a convertible features. Next, please. So this is it. We're going to raise 20 million. As in any investment under ECF, there is a minimum and there's a maximum. And the minimum is, should the fundraise hit 5 million, this will be deemed as a success campaign. And we can close the campaign, or we can continue with the campaign till it close to raise 20 million. It's all or nothing. Hypothetically speaking, in the event a campaign that is not able to raise the minimum amount, in this case 5 million, the amount that investor have placed the money or invested that are held in trust, in this case public trust, those money will be returned to the investors. Right? There's also a features in ECF is that should you invested before the campaign close and you change your mind, you just have to inform us and we can refund the within 6 days, we will refund the money back to you. No question asked. So minimum subscription in this case here for BreathDX is 5 million ringgit, which is 5,000 shares, 10% dividends. And that's the breakdown of the usage. These are just the key terms for now. Next, please. What are key terms? Well, conversion, right? In 24 months, 25th month onwards, conversion 1-to-1, very generous, 1-to-1 conversion ratio. Redemption, maturity, we have complied with, this is Sharia compliance. Shares, okay, because it is a syndrome Berhad, there is a limit of number of investors allowed. In this case, maximum is 50. But because this is a fundraising campaign, it can go more than 50 investors. So the shares will be held in AMB Connect nominees. This is the nominee for you so that first, it complied with the requirement. And second, it's easier for BreathDX where they communicate to the nominee and nominee then disseminate the information to the investors. Next, please.
I think, yeah. I think this one can invite Dr. Rajan to,
Oh, Dr.
Yeah.
Rajan.
Yeah. So, I think, if you want to look at a business today, you would like to start in a business that's global, right? Because the world is moving and the world is changing. You would like to be in a business that is high tech. You would like to be in a business that is in AI. You would like to be in a business that is in wellness. You would like to be in a business that is preventive. You would like to be in a business that is going to cut costs, because all these businesses are sure to grow and make money, right? Now, this guru, if you like, Peter Diamandis, has written a book called Bold, and he says that, a business that can go global, that can go rapid, and that can go profitable has to meet what he calls the 6D. The first D is it's digital, right? You do not have a physical product, or you do not have a physical mechanism of delivery. Think of Amazon, right? Number two, when that happens, there is deception. A new product is almost always dismissed or underestimated. Then there's disruption. You're creating a new market. The old one has just been overturned. And again, when market disruption, as all of us know, is opportunity, then you demonetize. You must make costs come down, because any business that makes costs come down will grow very fast. Think AirAsia, right? Then you want a business that doesn't involve every time, every country, we have to go and build new labs. Every time in every country, we've got to go hire a lot of people. Every time in every country, we've got to go and train a lot of people. Every time in every country, you need a lot of reagents, which are expensive. Think of how fast a Gribbles or a Pat Lab can grow, and whether or not Gribbles and Pat Lab can go out of Malaysia, right? Finally, when you do all this, you're going to bring costs down, right? When AirAsia says now everyone can fly, we will say now everyone can test, right? So we take that 6D, right? As I said today, if you want to invest, you want to put your money at risk, then you want to, first of all, you want to get into a business that is global. Because in a global business, one country can be up, the other country will be down, but you will get the best of it. Number two, you want to be in a high growth market. Testing is going to be a high growth market. I've shown results before. Number three, you want to be in a market where you can grow fast, where you're bringing down cost, where you're preventive, and where you are in life sciences. All of us are going to live longer. All of us are going to test. All of us want to find disease before it costs us our lives. It costs us our pockets. It costs us our suffering, right? So we, by the 6D model, we are in a very unique opportunity of a new technology, IT-driven, AI-driven, global, cloud-driven, that's bringing down costs and can grow and scale very fast. Next. So I always say that the next diagnostic platform is breath. When I was young, my grandmother used to bring her stools and urine for her lab tests. Then from there, we moved to blood. We moved to blood samples. We went to scans. We went to mammograms. We went to x-rays. Now we are going to the ultimate, which is breath. Many of you in this room are Chinese, right? In Chinese, we talk about the elements, right? So when a disease starts, it starts at the qi level, at the energy level. Then it goes to the air level. Then it goes to the water level. Then it goes to the earth level. So at earth level is when you see the body, when you see biopsy, when you see a dead body, right? At the water level is when you see urine and blood. We are now at the air level, closest to the qi level, the spirit level, right? This is the future. 25 years from now, we will be like Amazon is today. We will have changed the diagnostic market worldwide. Thank you.
Okay, thank you, Dr. Rajan. It's a good presentation. So right now we'll go into the Q&A session. So you can type up your questions if you like to speak to Dr. Rajan and ask about it personally. So you can just raise your hand and I will unmute the mic. So then you can just speak up and talk to Dr. Rajan. Okay, so if you would like to get a copy of the slide presented by Dr. Rajan, you can just click on the link that I sent it over. So you can just request it from our customer supports, okay? So I think we do have two questions on the floor right now. So first questions is actually asking, so does that mean single test will detect the various diseases markers in your system?
Yes. Our ultimate goal is with one breath, you will detect all top 10 cancers within 2 years. And with funding and the right thing, we will be able to detect also Parkinson's, Alzheimer's, traumatic brain injury, dementia, right? Every change in the body, right? Let's just go back to Chinese medicine. It happens at the qi level. From the qi, it moves to the air level. From the air level, it moves to the water level. From the water level, it moves to the earth level, the body level. So we are at the earliest. I mean, after the qi, it's air, right? So yes, one breath, many tests, many results.
Okay. So I think we'll be answer Sam your questions. So we have one more question is Ellen. So Ellen is asking, are we able to do a test and how much the test will be costing?
Okay, so in the US, we are charging $300 US per test, but you know, US is one of the most expensive healthcare markets in the world, right? Everything that's expensive. We are working at between 300 to 500 ringgit per test, which might sound expensive, but when you're doing 10 tests, it's only $50 per test, right? Far cheaper than a scan. Half or double the price of a Gribble's PET lab, which is you send your blood, you got to wait, and then you got different markers, which can go up to $300-400. So I think we have to price competitively because we got to penetrate the market, but we got to remain profitable.
So one more questions from Alan. This I think he's asking about this investment. Is it invest in the Malaysia company? Is that correct?
Any investment in a Malaysian company gives you equivalent share in the US company.
Okay. So does that mean they'll be invest in the wholly owned by Malaysia's company, right?
Yes, the moment you invest there, you're investing in every other companies in the group. Like for example, if you open up BreathDX India, or if you open up BreathDX Middle East, right? You'll be getting a share of that company. You will own a piece of the global operation.
Okay. All right. So any more question on the floor? Okay, I think one more. Tina. So Tina is asking about the return that if they are invested, if Dr. Rajan, you are seeing BreathDX going IPO or buyout, so what are the expected return that if let's say they're investing right now, how much they can expect? Yeah.
I don't want to be leading. What I would advise you is we are exchange listing LLC, which probably going to be our boutique partner is coming in on the 15th of July. AMB will invite you for those who are interested, those who've already invested, obviously priority for those who already invested, for a meeting with Greg and his partner who are coming. We'll have a meeting in the afternoon with them. So those who have invested with us, they could have a session in our office, those who invested, but you can hear from them. I've had early discussions. They are talking about 15x.
15x. Oh, so does that mean, I mean, conservatively, like 5,000 would be like times 15, the kind of.
Yeah. But like I said, I don't want that to be the new mark.
Yeah.
Listen, if you can double your money in a year, how can
Okay.
that be a bad thing?
Correct. Okay. So let me, personally, I have one question. I think I've spoke to Doctor. I think you are planning actually to bring the local Malaysian investors, like to visit US lab.
Yes.
So,
So I am talking to a lab manager tomorrow. So I will let AMB know. We'll set a time Monday or Tuesday next week for all of us to zoom in around this time into the lab and see a test being done.
yeah. So I also did paste up 2 links over there. So the first link, if you would like to reserve, the investment, you can click the link at just now I sent. If you like to invest in BreathDX VCF campaign, you can reserve over there. Okay. So the last one is that if you would like to be part of, to visit so-called virtually visiting lah. But of course, if you are in United States or anywhere nearby there, so you can actually just talk to Dr. Rajan. He can actually arrange up for you to be there.
If you are in New York, then I welcome you to visit the lab, and we will give you the test for free. If you're in New York or you got a relative in New York, let us know.
But if you are not, you're in Malaysia, so you can just click on the link and you can
Zoom.
we will, once we fix up the date, either it's next Monday or next Tuesday, then we can look it in, no problem. But of course, you can't do a test virtually lah. Okay. So Grayson has one question. Is this tag or this machine hard to be duplicated?
Yes. It's extremely difficult. It's blocked by 25 patents. As I told you, Dr. Sherman has told me that we are at least 3 years ahead of competition. And by the time they catch up, we would have a smaller, faster machine that's more accurate.
Okay. So you are ahead of others lah.
At least 3 years.
Grayson has the concern that once any tag goes public and information will be copied by others.
Yes. But that's why we have patents. And that's why you notice we are ahead of the whole world. We are ahead of Israel. We're ahead of Cambridge. We're ahead of the UK. We're ahead of Switzerland. We're ahead of France and Netherlands, right? Because it's not easy.
Okay. So anyone, if you have any questions, you may type on the chat. Okay, thank you. Thank you, Grayson. Or you can just raise your hand. I will unmute you. So I think we can take 1 or 2 more questions before we call it a day. Yep.
Sorry. I have one point to add on to the question about the tag being copied. Yes, the tag is going to be difficult to copy. And other than the tag, there's this gas chemical compound that you need to have to be able to duplicate. And on top of it, the markers that are stored in BreathDX cloud storage. So
thank you for that, Sam.
Without the cloud storage, that your machine is useless.
Yes, correct. And when you digitalize something, the more you use it, the more accurate it becomes. Just that Google gets more accurate when you use it. Google Map becomes more accurate when you use it, right? Waze becomes more accurate when you use it. So as we use more and more, we become more accurate. And therefore, it's difficult for a newcomer because they got to use as much before they catch up. All right? So Google is Google. I mean, many people try to duplicate Google. It's not going to work. Right now, if you follow ChatGPT, each time you use, they get smarter and smarter. So everybody following has got to change the rules in order to compete.
Okay. Thank you, Sam. Thank you for the echo. I think thank you, Dr. Rajan, as well. So once again, I will put up this link if you would like to join the virtual session for the US lab visiting. So you can click this link. Or if you would like to, like invest right now, to know what is the steps, what kind of benefits that you can get. These are the links that you can click. So after that, after today's events, our customer supports will be calling you. Okay. So I think the person in charge for this ECF will be Amina and also Wailing. So both of them will be calling you, to serve you in a better how you can invest in this campaign. Okay, so I think time is almost 9:40. So maybe before we end this, maybe Dr. Rajan, you would like to give a words to encourage everyone why they should take this opportunity to invest right now and in BreathDX. Yeah.
I mean, my summary is very simple. If you have money that you want to grow, then you want to put the money with least risk, with the highest growth opportunity, then I think we are good because we are doing something that nobody has done before, but we're doing something that everybody's breathing. And everybody knows from breath you can get something. We know this, right? We've been to a hospital where, a kidney patient, you get the smell of urine in the breath, right? Where if you have a diabetic patient, there's sweet breath, alcoholic breath. We know if at night, you're driving drunk, a cop can stop you and can get alcohol in your breath. So we know this is possible, right? We're making the additional step, right? And if you want to invest in any business today and you want to make money, then you want to be global, you want to be scalable, you want to be digital, you want to be AI driven, you want to be in wellness, you want to be in prevention, you want to be in healthcare, and you want to be in cost reduction. We tick all those boxes.
Okay, thank you.
I don't know, if you want to start in a business like this, right? Typically, it'll cost you $700,000. But here you can just start with 5,000, and you put it right now, if the campaign doesn't close, you get it all back. If you put it right now and you regret it and you want to take it back, you get it right back at no cost, right? But 5,000 can get you into a global business. 5,000 can get you in the fast growth business. 5,000 can get you in a game-changing business. 5,000 can get you into a business that was going to change lives. And $5,000 is going to get you a share in NASDAQ. Think about that.
Okay, thank you very much, Dr. Rajan, and thank you everyone for the time. Thank you for 1 hour and 15 minutes here. So if you would like to invest, that's the link that you can click in. If you want to, talk to Dr. Rajan himself, you can always just click the link and you want to reserve a time slot with Dr. Rajan, and perhaps want to visit any US lab that we will be scheduling next week. So you can click this link and make the reservation right now. So thank you again, and I think we call it a day, and we shall end this Zoom in like 3 minutes time. Thank you, everyone. Thank you so much. Thank you.
Thank you.